My name is Ramona Nedeva. I'm a third-year student at the English Medical Program of Medical University at Varna. I'm a Bulgarian who was born and raised in Chicago, Illinois, and have always wanted to study medicine due to its intriguing complexity and how every disease is similar but different based on the patients. I've spent my whole life translating Bulgarian to English and vice versa. One of my passions is teaching my colleagues about Bulgarian traditions, culture, and history. Jeslie is 20 years old from Northern Ireland in the UK. She's very interested in medicine because she's always liked science and was unsure about any other career that would adapt to her high expectations of intrigue. Her favorite memories are the summer season in Bulgaria, where she gets to utilize the nice weather and the beautiful beaches of Varna, where her and her friends have picnics. Her current interest is general medicine, and she has picked the topic of anemia and how common it is in today's society, as it is one of the most common blood disorders affecting 1.6 billion people in the world.
So today I'll be talking about anemia. So in this presentation I'll be talking about what is anemia, the prevalence of it, the types of anemia, the causes of anemia, the signs and symptoms, your risk factors, prevention, the diagnosis, the treatment. So what is anemia? So anemia is a condition where the body lacks enough healthy red blood cells or hemoglobin to carry adequate oxygen to the body's tissues. And hemoglobin is a protein in the red blood cells that binds to oxygen. So when hemoglobin levels are low, there aren't enough red blood cells. The body cells receive less oxygen, leading to symptoms like fatigue, weakness, pale skin, shortness of breath, and dizziness. So the prevalence, approximately 1.62 billion people, about 24.8% of the world population, are estimated to be affected by anemia, according to the World Health Organization. The prevalence is highest in low and middle income states and countries such as Africa and Southeast Asian countries, where nutritional deficiencies, infectious diseases, and there is limited access to healthcare, which contribute to higher rates. So in children, about 42% of children under 5 years are affected globally, making them one of the most vulnerable groups. And pregnant women, roughly about 40% of pregnant women worldwide suffer from anemia. This is due to the increased iron requirements that you need during pregnancy. And for non-pregnant women, approximately 30% of non-pregnant women, mostly in their reproductive years, are also affected due to menstruation and dietary factors. In men, anemia is less common than in women, but still affects about 12% of men globally. So the types of anemia. So number one is iron deficiency anemia, when it is caused by the lack of iron, which is essential for making hemoglobin. This can result from inadequate dietary intake, chronic blood loss, example during heavy menstrual bleeding or gastrointestinal bleeding, or if there is increased iron needs, example like during pregnancy, lactation, etc. So as I've said before, the symptoms you can experience are fatigue, weakness, pale skin, shortness of breath, dizziness, and brittle nails. The second one is vitamin deficient anemia, and this can be due to the lack of vitamin B12 or folate, which is B9, which are essential for red blood cell production. So you can get pernicious anemia, which is a type of vitamin B12 deficiency, where the body cannot absorb B12 properly. And then you can have folate deficiency anemia, often due to inadequate dietary intake of folate. So symptoms is similar to iron deficiency anemia, but also can include tingling in the hands and feet and mental changes in the case of B12 deficiency. And the third one is hemolytic anemia, where your red blood cells are destroyed faster than it can be produced. So this can be inherited, for example, sickle cell anemia, thalassemia, or acquired due to autoimmune disorders, infections, and certain medications. So sickle cell anemia is a genetic disorder where red blood cells are broken down, leading to their premature breakdown. Thalassemia is a group of inherited blood disorders where hemoglobin production is abnormal. So example, you can experience jaundice, which is the yellowing of the skin, dark urine, fatigue, and enlarged spleen. Another one is chronic disease anemia, which often occurs in people with chronic conditions like kidney disease or autoimmune diseases. These conditions can interfere with the production of red blood cells or cause them to be denature prematurely. Typically, mild to moderate symptoms can occur. For example, fatigue, weakness, and they may overlap with underlying conditions. Fanconi anemia is a rare inherited bone marrow failure disorder that leads to the decrease in production of all blood cell types, including red blood cells. You can experience physical abnormalities, short stature, increased cancer risk, and symptoms of anemia like fatigue and paleness of skin. And the last one is megaloblastic anemia, which is characterized by the presence of abnormally large red blood cells, megablasts, due to the impaired DNA synthesis. It is usually caused by vitamin B12 or folate deficiency. Symptoms are general anemic symptoms, but can also lead to neurological symptoms in the case of B12 deficiency. So as I've said before, the cause of anemia can be nutritional deficiencies such as iron, vitamin B12, folate, chronic conditions, kidney disease, cancer, chronic infections, blood loss such as acute blood loss during injuries or surgeries, chronic menorrhagia, GI bleeding, genetic disorders such as sickle cell anemia or thalassemia, bone marrow disorders such as aplastic anemia, myelodysplastic syndromes, and increased red blood cell destruction such as hemolytic or autoimmune conditions. So other conditions can include alcoholism, hypothyroidism, and side effects of certain medications. So the symptoms and signs of this is fatigue. You are constantly feeling tired, lack of doing anything, strength, feeling weaker and having less physical activity, pale or yellowish skin, in the lower eyelids, nails due to reduced blood flow, and you can have shortness of breath, which difficulty in breathing, especially during physical activity. You can experience dizziness, feeling faint, especially when standing up quickly. You can have cold hands or feet due to the poor circulation and reduced oxygen flow to the extremities. You can also have heart-related symptoms such as irregular heartbeat palpitations, in which the heart works harder to pump blood, leading to rapid or irregular heartbeat. You can have chest pain, which can occur in severe cases if the heart doesn't get enough oxygen, and headaches due to decreased oxygen flow to the brain. You may crave for certain non-food items, which is called a condition called pica, such as ice, dirt, starch, are often seen in iron deficiency anemia. You can have brittle nail and hair loss, common with iron deficiency anemia, jaundice, which is the yellowing of the skin and eyes, seen in hemolytic anemia, where the red blood cells are broken down way too quickly, tingling or numbness, and sore or swollen tongue and mouth sores. So the risk factors are mainly vegetarians or people who have vegan diets, as they lack the red meat, leafy greens, and fortified cereal. They're prone to vitamin B12 deficiencies unless they consume supplements. Pregnant women, due to the increased need of iron and folate to support the fetal development. Infants and young children, due to premature babies with low birth rate, are at high risk, and they may not receive enough iron fortified formula, or breastfed infants past 6 months without iron-rich complementary foods may also be at risk. People with chronic kidney disease, kidneys produce erythropoietin, which stimulates red blood cell production. So people with this disease have a decrease in this hormone, which leads to anemia. Diseases like rheumatoid arthritis, lupus, or chronic infections can interfere with red blood cell production. Another one is genetic disorders. If you have a family history of inherited conditions like sickle cell anemia, thalassemia, or if there is G6PD deficiency, increases the risk of these types of anemia. If you have chronic blood loss conditions like peptic ulcers, gastrointestinal bleeding, hemorrhoids, or cancers of the digestive tract, can cause slow ongoing blood loss. If you're having radiation or chemotherapy, these can damage bone marrows, affecting the production of red blood cells. Gastrointestinal disorders such as Crohn's disease, celiac conditions, gastric surgeries can impair the absorption of iron and vitamin B12. People with pernicious anemia, which is an autoimmune condition where the body can absorb enough vitamin B12 properly. So the prevention of this is having a healthy, balanced diet in which you can include both heme, meat, poultry, fish, and non-heme, such as lentils, beans, and spinach sources. Vitamin C, which can enhance iron absorption by consuming vitamin C-rich fruits such as citrus, fruits, and peppers. Do monitor your blood loss manage heavy menstrual periods and treat gastrointestinal issues, which can cause chronic bleeding. You can have supplementation such as iron, vitamin B12, and folate supplements if your dietary intake is insufficient, especially for pregnant women and vegetarians or vegan diets. Do regular health checkups, get routine blood tests to detect anemia early, particularly for high-risk individuals, and you can avoid certain substances such as limit caffeine intake and excessive alcohol consumption. Education and awareness, recognize the symptoms of anemia and consider counselling if there's a family history. And lifestyle changes, engage in regular exercises, stay hydrated, and consider fortified foods to meet nutritional needs. So the diagnosis of this, you can do history such as the symptoms, normal symptoms of fatigue, weakness, your dietary habits, menstrual history, family history of anemia and chronic conditions. Physical examinations checks for signs of anemia such as pale skin, rapid heartbeat, abdominal tenderness. You can check for paleness in your conjunctiva or in the nails. Laboratory tests include complete blood count tests, which is a key measuring hemoglobin and hematocrit levels, as people with anemia have decreased hemoglobin and hematocrit, and the mean corpuscle volume is also decreased in anemia. Iron studies such as your serum iron, ferritin, and total iron binding capacity for iron deficiency, as all of these will be decreased than the normal values. You can also look at the vitamin B12 and folate levels to check for deficiencies, and you can look at the reticulocyte count, which is the number of young red blood cells, to evaluate bone marrow function, and your peripheral blood smear to examine blood cells for abnormalities. You can do specialized tests such as biopsy of the bone marrow to see if if it's needed, hemoglobin electrophoresis to identify abnormal hemoglobin types, and you can also do the Coombs test to detect autoimmune hemolytic anemias. Screening is also recommended for pregnant women and children and individuals with chronic diseases or risk factors. They should be regularly screened for anemia. So the treatment is you can do oral or IV iron, like intravenous IV iron to replenish iron source. You can do vitamin B12 supplements for vitamin B12 deficiency. Same with folate deficiency, you can do oral folic acid supplements or dietary changes such as increasing the folate-rich foods such as leafy greens and beans. In chronic disease anemia, you can manage the underlying conditions to treat the chronic disease to improve anemia, such as if you have certain chronic conditions, and erythropoiesis stimulating agents, medications to stimulate red blood cell production. And for hemolytic anemia, you can also treat the underlying cause, such as autoimmune conditions or infections. You can give immunosuppressive therapy or blood transfusions for severe cases. And aplastic anemia, you can do a bone marrow transplant suitable for severe cases or immunosuppressive therapy to help the bone marrow recovery. And you can also do blood transfusions. People with sickle cell anemia, one of the treatments is hydroxyurea to reduce the pain crisis, or you can do blood transfusions for severe anemia management and pain management. So you can do lifestyle changes such as you avoid iron inhibitors such as caffeine, limit, and you limit the amount of alcohol you consume, and your regular monitoring of checking up on your blood tests and to track treatment effectiveness. And you can develop a diet plan to address deficiencies, and education and support. Patients should be informed about their condition and treatment options. So in conclusion, anemia is a prevalent condition that can significantly impact overall health and quality of life. So you can understand the causes, symptoms, and risk factors is essential for the diagnosis and management. Treatment options are based on the underlying type and cause of anemias, ranging from dietary changes to supplements to medical interventions, and preventative measures including balanced diet, regular health checkups can help reduce the risk of developing anemia, and awareness and education are also very key in the management of anemia for improving patient outcomes.